Welcome to Shebesh Speaks, the show and the platform for you on mental health. Today we are coming live from 37 on Kikambala in Kileleshwa. Thank you for supporting this program and supporting mental health. And today, as I promised, I have come with a guest, and I've come with a psychiatrist. My guest has been with me on the show, on the NTV show. I think you know him, Dr. Chitai. He is a psychiatrist and is also the chair of the Association of Psychiatrists in Kenya. But more than that, he has been speaking about mental health. He's been very vocal about it. And when I met him on the NTV show, we connected, and I felt that he understands what I'm trying to do here. So even if we are late, we will still take the 1 hour so that today you hear from the person who can help you, the psychiatrist that I talked about. And do not forget to subscribe to this channel, Rachel Shebesh, Mama Nai, Jenga Nai. And so, welcome, Dr.
Thank you, Honorable Shebesh, and hongera for the great work you're doing.
Thank you, thank you. You probably are one of the inspirations for me to do this show. From the time we were together at the NTV, I got a lot of response. Hence, I decided to do this platform.
Yeah.
In my first show, Dr. I talked about myself and my journey, which you know because we've shared with you.
Yeah.
Today, as I ask you to tell us about yourself, I'd also like you to answer this question that always nags my mind. Why do people fear going to psychiatrists?
Thank you. And so, my name is Boniface Chitai. I'm a consultant psychiatrist and currently the president of the Kenya Psychiatric Association in Kenya. And so, good question. Because I've also encountered a lot of my clients as a general practitioner before I became a psychiatrist who will be great friends until the point when I told them that now could you please, visit a psychiatrist. Yes. But I think it has something to do with our cultural background. We are a country in which we've grown up fearing mental illness. And we are not alone as a country. Mental illness throughout the world is generally feared because a person's brain is really the center of their humanity. If we were even to talk about the soul, probably the soul lives in our brain. So when someone thinks about mental illness, also the thinking is quite catastrophic. We often think about mental illness as this very severe disease where somebody is only on the streets, where the person is homeless, where the person does not know themselves, because that's the image we've grown up with right from our villages.
It's like if you are diagnosed with a mental health issue, it's like a death sentence.
It's like a death sentence, it's like a one-way road, there's no coming back, and that's the fear. And the society will look at you negatively. What will people think about me? Now you're sending, even the idea that you just went and saw a psychiatrist, even if they told you that you are well, it is a secret that anyone would want to keep.
And how do most of your patients get to you?
A lot of my patients will get to me either through referrals from those that I've already seen. Some of them get to me by looking up my contacts on the internet. Unfortunately, others also get to me because their relatives have almost forced them to come and see a psychiatrist. And I think that last category is the most difficult.
Because what I'm trying to promote, Dr. is a space where Kenyans can realize that something is wrong. And if you yourself can't realize it, then somebody next to you, somebody, either in your family, in your workplace, somebody can realize. What I am striving to do on this platform is to get to a point where looking for help from a psychiatrist is something you can tell yourself to do, or those around you can be comfortable to tell you to do. Are we near that space?
I mean, it's a wonderful dream. I also dream of that day when persons will even go to a psychiatrist for a mental health assessment. After a while, maybe once in 6 months or once a year, the way a lot of people these days, for their checkup, for their hearts, for their liver, you know, and they probably talk about it. That today I'm a cardiologist.
I did my monthly yearly checkup. Actually, we talk about that a lot.
A lot. You know, I went to check for cancer. You know,
I'm okay. I'm told I'm fine.
Yeah.
But maybe they're coming out of there fine physically, but not mentally.
How I wish that that they will realize that actually mental health is just part of health.
Yes.
That the brain is just part of the body. Probably more precious. Probably there should be more people talking about having gone to see a psychiatrist, because the brain is such a precious component of a human being, and it controls all the other organs. So how I wish that we can get to a point where people proudly talk about it, people proudly interact with the psychiatrist, especially psychiatrists. Actually, people don't fear psychologists as much as they fear psychiatrists.
Because psychologists talk you through the issues, psychiatrists will tell you, you have this disease and you need to take this medication.
And then they give you medication, which we also fear that this medication...
Tell me, because I take the medication, I know. But explain why medication for mental health also creates such fear.
Yeah, it does create that fear because, again, from our starting point, it's like our brain is the center of our humanity. So having to take something that could alter your brain in, that's what you know, that it will do some alteration of the brain chemicals. It does create some fear, and especially there's a myth that that the medication that people take for mental health purposes, that causes people think that it will cause you to be addicted to which is not true. Also, the fear has probably come from this history whereby the older medications that were used for mental health had a lot of side effects. So a person will come and they will be treated, but then they will sleep the whole day. You know, either that or they will encounter some challenges, shaking and whatever. Tremors. And that made it very, the disease was almost as bad as the illness in a way.
And Dr. when I started my medication, and this is something I spoke even to my friends about, those who are watching me, that for me, my medication was a lot of, that we did a lot of trying and changing the medication, mostly because of the effects it was having on me, and I needed to continue working. I was a member of parliament. And so I remember when I took my first medicine, it made me lethargic, as you say. I was slurring my words. I was shuffling rather than walking. And I was literally looking like a zombie. So people would see me and they would know. And then I put on a lot of weight. I mean, I gained tremendous weight. So there is truth to the fact that there is medicine for mental health and it will have side effects. But I've always asked, which medicine have you ever seen for any other treatment that does not tell you a side effect?
And the answer is zero.
Zero. Even the one just to put on a pimple, you will be told if it reacts, please rush to a doctor. So I think we shouldn't fear, and I'm talking to the people who have mental health or those who are the family members. I don't think you need to fear the effects. And depending on the severity of your condition at that time, like mine was, I needed a stronger dose of medication to first stabilize me, and then I was able to roll out to medication that didn't have too many side effects. However, even now with my medicine that is managing me, I do need to see my psychiatrist regularly to change my medication as I'm progressing. I learned something this week, Dr. Ali, and I talked a lot about my medication and how happy I am with my medication, and I'm on my medication. But I learned something this week, because I'm learning something every day, that I need to have a regular review of my medication. And even if I have had a medication working for me very well in my mind, it has not stopped me from getting the same feelings of depression coming on or of mania. And what I got to understand is maybe it's time to relook at my medication, because it's not a guarantee that when you're on medication you won't go into depression or also go manic. Comment about that.
And it's also important, and it's absolutely right, that if you have been taking medication for a while, it's important that you also get some reviews. The reviews could be looking at the medication, whether it's still working well for you, but it could also be looking at your body, because this is, you're putting in medication. So every so often, a doctor may request some lab tests, check on your organs, check on your liver, check on your kidney, because you have been taking the medication. And secondly, you also need to know that our brains are also affected by many factors. So no matter how good the medication you are taking is, also aspects of psychological and social well-being are important. So how is a person's lifestyle? So you could be taking the best medication available,
but then doing other things.
You are extremely stressed. Maybe you are not sleeping. Maybe you are in an environment that needs to be modified, not the medication, the environment. So that's what people should know.
Actually, that was one of my reasons for stopping alcohol. Because I realized that taking alcohol was sabotaging my medicine, literally, and my well-being. But when you talked about the fear of addiction to medication, I do know that people get addicted to pain medication. That means, again, on addiction, to remove the stigma around that addiction to medication, because it's something we have discussed with my doctor many times. Once when I was on a certain medication, she was quite clear it is for only 6 weeks. My insomnia, my lack of sleep, I don't know whether as many people with a bit bipolar like me, has never really stopped. I still have an issue of falling asleep even now. But the medication that my doctor and I eventually, my doctor, why am I saying I, like I'm the one, gave me, had a sleeping effect. So it deals with my bipolar chemically in my mind to help stabilize my mood. But its side effect is sleep, so that I can also sleep when I take it at night. So how do we also demystify the fear of drug dependency versus the need to take this medication?
I mean, it's and even having said that, a lot of the medication we give will not cause dependence, except a very small number.
Yes, which you're very aware
of medication. And mostly it revolves around either pain medication, which maybe it's not even the psychiatrist who is going to give you, but they're going to be given in hospital when you go there with some migraine or some abdominal pain in some hospital. So the opioids, what we call the opioids, the likes of tramadol and the like. So those ones will have that dependence effect. If you use it for a while, you may find now you cannot do without. And of course, there's been a lot of discussion about the opioid crisis in the Western world, which I'm thinking, hopefully not, God forbid, it may be coming to our countries in Africa, because there are stories about Nigeria now and so on. So you need to be more careful about drugs like tramadol. You also need to be more careful about medication that are given solely for the purpose of lack of sleep.
Yes, for example.
Which you've rightly called insomnia. So insomnia or lack of sleep is usually a symptom of many different conditions in psychiatry. So bipolar mood disorder, for example, could lead to lack of sleep, depression, lack of sleep, schizophrenia, lack of sleep, a lot of problems. Post-traumatic stress disorder, lack of sleep, a lot of them will have some lack of sleep, all right? But our approach is usually that it's important to treat the underlying condition and not just the lack of sleep, because if the underlying condition resolves well, lack of sleep should also, in most cases, resolve, such that if I'm giving medication for lack of sleep while I'm starting treatment, that should be for a short time.
For short
then
time.
we stop.
Exactly,
Maybe 2 weeks.
which is actually what happened to me.
Yeah.
Yes, that's exactly what happened to me. I stopped the medication of sleep because I was able now to be balanced. But
also,
yes.
can I add something?
Yes.
In terms of sleep, also it's important to know that even before, if you're having some challenges with sleep, even before starting to use medication, it's important to exercise some behavioral changes in your lifestyle that will lead to better sleep. It's called sleep hygiene. So I'll run through them quickly. One, sleep and wake up at a constant time on a daily basis. So if your sleeping time is 10 and waking time is 6, let that be constant. And then the sleeping hours, let it be 7 to 8 hours. Few hours of sleep, like 4 or 5, will mean that your brain will not rest enough. Do not sleep during the day. Do not spend time in the bedroom during the day, or read or watch any movies in the bedroom. That will affect your sleep. Avoid coffee or tea in the evenings. Then avoid exercising very late in the evenings as well. These are some strategies, and also where you sleep, make that environment to have as less stimuli as possible. No light, no noise, and avoid electronic gadgets as you go to sleep.
Meaning don't watch Netflix to sleep and don't listen to music up to the time you sleep. That is something that people think is a good thing. I was part of it. I had a lot of stimulation as I was going to sleep, a lot, and therefore I had to find myself in a way to put off the light and be quiet and wait to sleep. That I think is strange for most of us, but it's something that helps. Before I get out of there, let me talk about aches and pains. I have aches and pains that I never used to understand, that now I can relate to my bipolar and its effects. For example, when I'm having anxiety or stress coming and anxiety, I have aches. I have pain like on my shoulder here, and sometimes it's on the back of the shoulder, sometimes the front of the shoulder. It can be on the knee. And for long I tried to get treatment for this pain, and it couldn't be sorted. But the moment I started getting my treatment and speaking about it, I realized it was stress related. So is it true that sometimes when we keep going back and forth to a doctor with the same aches and pains, it's about time to consider whether it's a mental health issue?
It will be very important to considering that in our earlier days of learning science, we learn about 5 common senses, which is seeing, hearing, tasting, smelling, and touch. These senses are controlled by the brain. All these senses can actually be produced in the brain without any external stimulus or stimuli. So you can feel someone touching you if they touched some part of your brain. If there was a way they touched some part of the brain, you'll feel like your hand is being touched. So when there's some challenges with the chemicals in the brain, some sensations can be produced, including pain, that is not coming from a damaged organ of your body. It's being produced inside the brain.
Wow.
Yeah.
That answers a lot for me. Dr. I had so many questions in the last YouTube channel I had, and obviously also some from the interaction we had through the media with you. And I would just like to give you some of those questions, and if you could answer directly. Remember, I promised that I was very clear that I am not a psychiatrist. I do not know the medical answer to your questions, but many of you who have responded to some of you who have sent me messages even through DMs, I've been able to respond, but I have underlined that when I have the psychiatrist on the show, I will ask these pertinent questions so that they're answered. And before we go even to the questions, the number one question for everybody, it is permeating through all the comments, all the questions is, where do I go for help?
Okay.
And I'm asking you this not as, where does Shebesh go for help? I'm asking you about that young lady, that young girl in Mukuru. Yes.
So that's a good question. Where does one go for help? So if you are experiencing some of these symptoms that we mentioned here, but also others maybe that you've had, that are related to some mental illness. It could be that perhaps you feel like taking your own life, you've not been sleeping for very long, you are very angry throughout, so if you're having some of these symptoms that, or perhaps you are using alcohol too much or other drugs and you cannot stop, you're trying, you can't. If you're having some of these symptoms that indicate that you might be having a mental illness, then the best place to go is a hospital, right? And it doesn't have necessarily, I don't have to give a specific name of a hospital, but any hospital you go to in Kenya with any condition, the health worker you find there is supposed to do one thing, to establish whether he is able or she is able to treat the condition, and if it cannot be treated, then refer you to where you should get help. I think that's the duty of every healthcare worker. At the moment, there are a number of hospitals in the country which now have psychiatric services, where one could go and they get those services. So if, for example, you are in the western part of the country, hospitals like Kakamega, County Referral, hospitals like Kisumu, the Jaramogi Odinga Referral, Kisii, County Referral. If you are in the Rift Valley, hospitals like Nakuru, Moi Teaching and Referral Hospital in Nakuru. If you are around Gilgil also is a hospital that is offering services. If you are down at the coast, hospitals like Mombasa County Referral Hospital. If you are in Central, Kiambu, Thika, Level 5, Nyeri, these are some of the hospitals that will offer some services, actually psychiatric services. If you are in Eastern, Meru, Embu, and down Machakos, and Makueni also, county referral hospitals offer psychiatric services. If you are in Nairobi, you have many options. So you can either, there's Mbagathi, there is Mathare National Teaching and Referral, and then there is also Kenyatta National Teaching and Referral. So Kenyatta National Teaching and Referral has had a youth center that caters at fully subsidized cost for persons who are aged below 24 years. So if you go to the center, then you can get those services that will include some counseling and some review by a psychiatrist, and you'll be able to
There's a region you have not mentioned, which is the northern part of this country.
Yeah, the northern part of this country, I cannot recall if they have a psychiatrist, but I'm thinking that Garissa might have. Yeah.
Garissa Hospital.
County referral, yeah.
That is something that has been very important to the people who have been writing to me, and I am glad that you've given it even region by region, because there is really, we would be selling ourselves short on this platform if we came here and talked about mental health and we didn't tell you where to go. So I want to say also to you that I will spend a lot of time on this channel referring you to where you can get help. It will be much more about referring you to where you can get help, and then also telling you that it's okay not to be okay, and bringing people on this program who can speak like myself, who can tell you their experiences, programs that are being run around the country that are helping people. And let me take this opportunity to quickly tell you where young people are congregating. I have met a young lady called Yvonne Echieng. They are running a program called Cities Rise in Nairobi. What has excited me about Yvonne is in the room as I'm speaking. Yvonne has told me about the program that they are doing and what they have established, because remember we have said before, and I spoke about it, how worried we are about our young people and our youth, and how scary it is for parents right now when we see the rate of suicide. Why it is the reason why the president spoke about it on a national day, when we saw that there is a crisis around mental health with young people, and especially the issue of suicide. So Yvonne and her organization Cities Rise have established 2 youth gathering centers in Nairobi. One is in Huruma and one is in Mukuru. And what they do, which I think is amazing, is use art and talent to speak about mental health. Because when you speak about mental health, like, this is it, there's something wrong with you, etc., young people could run away. But when you bring it out through art and peer-to-peer, then you find the young people will listen much more to that kind of interaction that they would listen to us sitting where we are as their parents and as the medical fraternity. So please, if you are in Nairobi or you would like to know much more about this program, they also have, they're promoting psychodrama. I like young people because I was once young. In 3 universities in Kenya, Daystar University, Kenyatta University, and the University of Nairobi. Again, at the universities where our young people are getting education, you can imagine somebody with mental health having to go through their course and failing and not being able to take their classes sometimes once in a while, etc. And in an environment such as that, and with the kind of money we've put in education, how can we not look at the health of the young people, the mental health of the young people? Because by the way, that is where you're really using your brain throughout the time. So they have also a program through Daystar, Kenyatta University and University of Nairobi. And then what they're also doing, which is exciting, is building the capacity of you young people who are listening to me. You want to do something. I have so many people who have said, how can I help? I want to raise awareness on mental health. Cities Rise are giving you an opportunity to be trained as a peer counselor, as somebody who can interact with the young people on mental health. So if you're out there and you're passionate about it and you've always wanted to do something about it, here they are. So I thought it was important that I talk about that because I also said that I'll be connecting you. Let me go back to the doctor and ask you a few of the questions now.
Sure.
And I will look at some of the questions that are coming in now. But for my last show, there is one young person who just asked a very general question. And I thought, should I even ask this question? Then I thought, maybe it is important. There's a young gentleman, I'm assuming he's young by the way, but I think he's young, who just asked, how do I stop smoking marijuana?
That's a very interesting question.
It's very interesting.
Yeah, marijuana is said to be one of the most commonly used drugs across the world. And for people who smoke marijuana, if 10 people smoke, 1 will become dependent. What does it mean? It means that they'll be unable to stop. You know, they'll try and they'll find it difficult, and they may continue using it even when they're having some challenges, or either health-wise or mental, and they'll spend a lot of time using marijuana. So, I mean, you hear young people talking about wake and bake, meaning they wake up in the morning, and the first thing they do is smoke marijuana.
Wake and bake?
Yes. So
I'm hearing that for the first time.
So they wake up in the morning, the first thing they smoke marijuana, they smoke during the day, they smoke in the evening. So like they spend the whole time, you know, smoking.
Yeah.
Now, studies have shown that actually marijuana can lead to serious mental illnesses, including what we call psychosis, where a person where a person has a complete break with the reality, where the reality is different, where they now live in a different world, only known to them. And so,
Doctor, you tell Alex.
So I just want to give him some background, because also, Mheshimiwa, as you know, there have been a lot of discussions about whether marijuana is a very useful drug that actually should be legalized, so that people can use it. You know,
medically, like it has some value.
Yeah,
yes,
I mean,
there's been that discussion.
Of course, some small amounts can improve appetite for persons who have cancer, and this, you know, there's that use that is known, not in Kenya, but licensed in other countries. However, the use for recreation can also create problems, and that's what young people should know. That 1 out of 10 may become dependent, like the way Alex is saying, is trying to stop. All right, and because of that, then such a person, dependence is an illness. Yeah? If you are dependent, if you are trying to stop and you can't, then that's an illness. So you should not think that you will be able to do it alone. It will be great if you can, but if you have been trying and you can't, it's important that now you get in touch with the rehabilitation services, there are a number of rehabilitation services around the country whereby you can be given some medication during the period when you stop using it so that you don't get any withdrawal symptoms and the urge and so on. And also you go through various counseling procedures to help.
Thank you. I hope, Alex, that has answered you. Dominic asked also an interesting question. Dominic asked, is stammering also a cause of mental illness? Speech therapy is too expensive for them? Is it possible that stammering, and I guess the stigma that comes with it, could lead to mental illness? Or is it a sign of mental illness?
Yeah, I mean, yeah, stammering is still a condition that can be linked to the brain because the brain has what we call the speech centers. So there's a center in the brain that helps us to speak, and there's another center that helps us to interpret what other people are saying. So there are those two centers within our brains. So because of, again, brain development is such a fragile process that sometimes something can go wrong within that development of that part of the brain that helps in production of speech. And so that now becomes a challenge that can lead someone to have that stammering. However, the brain as an organ heals and adapts. So through practice, someone can actually improve their speech.
Yes, of course.
Yeah,
yes.
And that's why maybe the speech therapy is there and so on. But the stammering itself is not classified per se as one of the mental illness, because even someone who is stammering, they have no problem in their thinking, all right? They have no problem in their emotions or feelings, and their behavior may just be normal. So it's not classified per se as a mental illness, but it's classified under neurological illness. So stammering could be classified together with epilepsy, for example, where someone loses consciousness and they convulse. So, one of the things that makes these conditions also very challenging is the stigma attached to them.
Of course, I think it's still stigma for me.
The stigma
because
I
was in school with many, I think everybody has encountered somebody who was stammering when they were in school with them, and it never stopped their capacity to do anything. And if I think about stammering and what I go through with my mental health issues, the correlation would only be if I am bullied so much and embarrassed so much about my stammering that it now leads me to start having issues that would probably lead to mental health. But I would think that I agree with that both speech therapies in Kenya very few. When I was doing my work on, I have passions upon passions that I follow. I don't know if it's a bipolar thing. When I was doing my work as a women rep, I really concentrated on children with disability and integrating them back into society. And one of the things that I found was that we had only, 4 or 5 speech therapists in the country. So basically, this is a question that is being asked because of a lot of lack of information and support around the health system. And that's why you're here that time. And
you probably may have you may have discovered that even for disability, we can reduce the extent of disability by providing an enabling environment to the person.
Exactly.
Yeah.
Exactly. Because when I realized, now that let's just speak about that, I realized that first of all there is again a sense of stigma that projects itself almost like embarrassment for people who have children living with disability or somebody with disability. And then there is the other very real issue of how to manage a child with disability. So when I realized that our schools in Nairobi are supposed to have integrated classes for disability, I went around the schools and I identified the schools which are supposed to have children with disability integrated into the learning. And I created and I renovated classes in those schools in every constituency in Nairobi. I put in the toilets for children with disability. I then went on to equip. And I thank God that the current women rep, Esther Pasaris, who I said is also a pillar for me on my mental health issues, also completed the program. So immediately we could see from the parents and from the children the fact that you can come into a classroom that looks like a classroom because the classrooms were not even looking like classrooms. That's why I had to renovate them. That are tailored to your need and your type of disability.
Yeah.
And then you find that you have a teacher there, and also you have a the ones who do the massages. Physiotherapists who are very, very important for children's disability. And then you have the equipment that you need to learn. It was like an instant. For those who were able to interact with it immediately, I could see it when I would go and I would meet the parents there. You could see an instant, improvement or hope in these children's disability and for their parents. So, in a way, that's what I'm hoping will happen with mental health.
Yes.
I want us to reach a point at time where anybody with mental health, parents with children with mental health, a wife like myself who has mental health, my husband doesn't need to be embarrassed to talk about it. And then we will see the shift. Because it's like a leap of faith, don't you think, that if we could get there, if we could get everybody to reach where we are now, if tomorrow somebody else in government spoke, I can assure you it will make a big change. Tomorrow, if one of you celebrities who have spoken to me spoke, you will sell millions of records. People listen to your music every day, and you have a mental health issue. If you spoke, people will listen more than even listening to Daktari here. They will respond like
no one wants to listen to me. No one wants to listen to me.
So I reach out to you who are going through mental health. You have a family member who has mental health. You are comfortable in the space of knowing now you are dealing with mental health. Please come out and speak. You will save quite a number of lives, I can assure you. Daktari, let me ask you another question very quickly. Or let me go here. Let's see what somebody's asking now. Everybody just keeps saying, keep sharing, keep opening up the space. Was this space so closed?
Yeah, totally. And one thing, and I like that there is this positive response to your sharing. Because that's also important. One thing that keeps people from sharing is because you don't want to be ridiculed by some fellows online who are less informed, and they'll say whatever. So people fear, and if there was more support, then we will definitely see more people.
On that note, let's talk about the story that hit the headlines in the last 2 or 3 days, I think. The incident with the police officer, and his wife was also a police officer. Something that I talked about in our show when we were together. I did say that we have opened in our ministry, being the ministry in charge of public service, a unit on mental health. Because we realized that these cases of people working for government, public servants, police being one of them, everybody who works for government is a civil servant. They are under our ministry. Of course, we realized the challenge that was there. But even with that unit, we are still having these incidences. What would you advise us to do with this unit so that it actually makes an impact, and so that we don't have to have the case that happened yesterday, which has happened numerously in this country? The fear of even having somebody with mental health issues carrying a firearm is real. What would you advise as
we must look at all work environments as communities, and look at all communities as spaces that require mental health. So creating an environment that again enables people who need help to get that help. Perhaps even within the environment, because sometimes a lot of these challenges will begin as milder problems. I'm having stress because of ABCD. But if I found a professional within my work environment who is part of the staff, whom I can speak to, that problem will not complicate into a more severe problem. So we must look at all these spaces, be it schools, be it colleges, be it workplaces, be it ministry departments. We must look at them as environments. A lot of times, obviously, if you're working for government department, the focus is often on delivering the service for the public, but seldom do we think about our own health, you know, as workers, and we are also affected by all these challenges that affect everyone else. So it's important that we have such mental health and psychosocial support services. If you have a professional there, they will also know where they can advise you to go in case. And then, with regard to governments,
how do you get this police officer who is going through some stress? How do you get this director of administration somewhere? Even if they know that there is support for it. How do we make that shift? What would you tell them? What would you talk, if you are talking now to, let's even say specifically, those in our country now working on our security matters? Because security issues are very stressful. And therefore we are talking from the police range up to the army. They are dealing with security issues. They have the capacity to be overwhelmed by those issues. What would you tell that officer?
I will tell them that working in the security services puts you at a risk of actually encountering a lot of trauma, which is pain that you have to endure sometimes helplessly in the course of your work. And this pain a lot of times also rubs on you as you do that work. So you are encountering people, some who are injured, some who are dying, you know, you're going into combat situations, you know, where there are robbers and so on. So there are all these risks that come with the job of being a security officer. And also the fact that they have ready access to firearms. Also that's an important thing for them to be able to know. So know the risk associated with the job. And apart from security officers, also even health workers are also at an increased risk, because when you work in the hospital, we know all the poisons. We know and how to use them. You know, so we are also at risk. So
and also dealing in a situation which is also very traumatic.
Yes. So, but what I'm saying is that because this work still is important for the society and has to be done, okay, then we must provide an environment that helps people process this pain so that they don't carry it and accumulate it. So that is what is important, and education is just one of them, but also just providing that, you know, that service, that critical service can be counseling, you know, that someone after going through this combat, what then happens? If nothing happens, they carry that trauma with them, and it can end up causing them a lot of personal pain, and that's what leads to some of these incidences.
And so, as I say again, pole sana to the family who have lost their two loved ones in the last incident, and many other incidences that have been before. Please, I want to reach out to you as public servants, civil servants, working for government, that we do have a mental health unit set up in our ministry. And it is the Ministry of Public Service and Gender. You only need to take that time to look for it in our websites, on our Facebook, or any other way you know as government that we interact, and know that there is help. In fact, I'm saying this more importantly for those who are working, but also for spouses and children of those working in government who know and who can feel that something is wrong. We have set up that unit for our civil servants and our public servants, because as the Secretary has said, we know we carry a big burden as we are working for this country.
Mheshimiwa, can I ask you a question?
Yes.
If today as a civil servant I walked into your unit, mental health unit, what services can I get?
Well, the immediate service, and I will bring the mental health unit person here, or I'll bring actually our PS, who is very, very, very passionate about it. But the immediate thing we did was to put in, I think, 50 or 60, if I'm not wrong, counselors, and connected to psychiatrists as well. And we put out a list that you can, you know how in government you have a list of doctors that government has approved maybe for insurance or whatever purposes.
Yeah.
What there never was was a list of those who you can go with for mental health issues. But beyond that, because government works as one, even as we set up this mental health unit to be a quick response or somewhere quickly people can go, we still look for the structure that is government fully integrated. And so we wouldn't really be saying mental health unit in our ministry is the end of this. We would be saying it will help you, then connect you, as you have said, to what, through the Ministry of Health and through government, is available. However, why it was important for us to have that opportunity to have these counsellors on board and to make them available is because, of course, you know, we have a great big workforce. But because we know in government that what you see out there shown on media about these situations like that which I'm talking about, of the 2 police officers, we know the numbers are greater than that. We have also seen a lack of, how can I say, productivity in government because of mental health.
Yeah.
You will find that we have actually, in public service, we have an aging public service. Many of our public servants will be retiring in the next 3, 4, 5 years. So you're talking about a 50 going to 60 age. And somehow, having been in government for long, because if you work for government, you work for government for many years, progressing up, there is a feeling of hopelessness and there's nothing more I'm achieving in this job, and I just come to work and go. And we found that there are very many of the people who work in government right now really not having any enthusiasm for work or motivation. And that also was something important for us, because we cannot have an unmotivated staff.
Yeah.
And you know, you can motivate staff with money, bonuses, etc. But if their mental health does not, you know, if they're not ready, they're not even interested, then what are we supposed to do? So those are the kind of reasons that we set up this support unit, the mental health unit in our ministry. But it cannot function fully, as I said, until it's integrated and people are aware of what the Ministry of Health is doing. And on that note, we will be bringing on board members of parliament who are doing legislation on mental health, as well as members of the mental health task force unit, that was the task force that report that was completed recently, and now there is a director of mental health working on it. I am working very hard to make sure that you are also aware what government is doing, at what pace, how much more emphasis needs to be put, and maybe through this platform you can tell us where the gaps are, because also no legislation is ever perfect. You can also tell us where the gaps are. So Daktari, as we are almost concluding, let me ask you another question, which was, many were direct messages, so I'm not going to mention names on these ones.
Okay.
But I have only one friend who discuss mental health with, who has bipolar like myself, but she's not able to get out of her depression or her mania without electrotherapy. What is electrotherapy? And why does somebody need to get to electrotherapy?
Okay.
Is it called electrotherapy first?
It is called electroconvulsive therapy. Yeah. So, but that's a very also good question. Because, yes, you say if you have some mental health challenges, some think you suspect maybe an illness, come to hospital. So, however, that's the good news, is that a lot of people come, will recover, but there's a percentage that always does not respond even to the medication that is available until this time in the scientific journey. We've not discovered some medication for some of the illnesses. So in the situations where some of the illnesses are not responding to the medication, we find that electroconvulsive therapy, which is a form of treatment that simply uses a small electric current being passed through one's head, all right, when they're asleep, not awake. So It's called convulsive because it gives you a shock. So that shock is some sort of like a convulsion, you know, but for a short period of time.
Okay.
It is known to be safe for nearly all age groups, and it can even be done in pregnancy. It is sometimes the best treatment of choice if someone has maybe very severe depression, they're suicidal, they're not eating. You know, in very severe depression, someone could just lie in bed and not do anything, and they don't eat, they don't do anything. So in that severe state of disease, we use it. But also, you mentioned something with mania. Also, if it's a condition like that is not responding to medication, that have been treated for a while, so electroconvulsive therapy can also be suggested. You are given a certain number of sessions on different days, maybe going up to, it could be around, could be 2 to 3 weeks, you know, of three days in a week.
Now, do you go back to the medication now?
Yes. So it's advised that after getting that electroconvulsive therapy, in short we call it ECT. Yeah, so after getting that, then you can go back to the medication. Studies show that people respond better to the medication after going through the ECT.
Okay, so I've answered the question to the person who had asked me about the electrotherapy. It came up, I think, in 2-3 people. Convulsive therapy. One, it's available. 2, it is safe. And 3, it's for time frame to lift you, so that then you go back to the normal treatment. Is that the way I can understand it?
Yeah.
More or less? Okay. A question here, Dr. from Betty.
Yeah.
Betty says, I have heard it said that those who end their lives are really wanting to end the suffering. What are the signs of a young person reaching this stage?
That stage. And I totally agree with Betty's, she's called Betty?
Betty, yes.
The suggestion.
Betty, in fact, it's my sister. It's Betty Kinomias.
Okay.
Yes. Who actually is also diagnosed with bipolar.
Okay.
Yes.
All right. That's interesting. That's close to your heart.
Yeah.
So, yes, that's true. Nobody, no human being wants to end their life. None. So, any human being who starts thinking about ending their life is doing so because they are encountering pain and they feel a sense of hopelessness about the pain. Those are the two conditions that usually make people think about ending their lives. And this pain could be physical. For example, I have chronic back pain. I've seen tens of doctors, but there's no improvement. I am starting to feel hopeless about it. So pain and hopeless. So you feel, so why should I just live and yet I'm not enjoying life? Life is about enjoying it. So that's how this comes about. Some signs that there are signs that one can see in an individual, yeah, that will make you suspect that maybe they are trying to end or they think about ending their lives. One of them could be researching about methods of ending one's life on the internet. That would be one. Number 2, saying bye-bye to your friends, putting your things in order, as if you are going. But the interesting thing is that actually people do talk about it.
It's just that we don't catch it.
And sometimes you ignore it, and sometimes you just make fun of it. So how many times have you seen something on the internet, even on Facebook, of someone having written a long post about thinking about just ending it all? That this pain is too much, I'm done. But then what do? You just go there and say all manner of things that doesn't help, the person. So many people who actually end up ending their lives have spoken about it. They've spoken about it. So listen to the person. Do not judge the person. Just give them. You may not know anything. You may not have the professional knowledge, but just listening is enough. Then advising them of where they can find help.
As you conclude, Dr. You have said the thing that I am very passionate about. I always ask, do you ask, how are you doing? That's a very important question to me these days.
Yeah.
Like, how are you and how are you doing? I mean, you can start your conversations with somebody like, hey, where were you yesterday? Why don't you just start with, hi, are you okay? Are you good? And listen to the answer.
Yeah.
Don't make it just part of your question and move on. As we're concluding today's session with you, I want you to take this time to speak to mental health as beyond bipolar disorder.
Yeah.
Because as much as I have bipolar disorder,
Yeah.
and I'm on this platform on bipolar disorder, there are many other mental health areas. Because I also got very many questions on ADHD. I got a question on schizophrenia. And so maybe I can give you this as you conclude as well, to maybe touch on, let people know that it's not only bipolar disorder that we are here to speak about. We want to open up the space on all mental health issues.
Thank you. Yeah, you're absolutely right that there are many mental illnesses. We have in total about 200 mental illnesses. Bipolar is one of them, but we have many other mental illnesses. What I would like to say to everybody is that all these illnesses are diseases of the human. We encounter these diseases because our brains are very complex. So the more complex the machine, the more likely something will go wrong. And so our brains are so complex, and therefore something can go wrong and you can suffer from any of these diseases. Nobody is immune to any mental illness. So there's no vaccine against mental illness. So as we go about our daily activities, as we encounter people with mental illnesses in our family and within our circles of work and so on, one thing to remember is that any of us can suffer from a mental illness. And although one may feel uncomfortable thinking about it, but we should get to a point where we actually do some soul searching and even some preparation for what if I got a mental illness, what would be my plan?
Thank you, Dr. Thank you very much, and you'll be part of this show for a while. I hope you won't get tired. I know you won't, because I know you're passionate about it. And so, therefore, as I conclude today, I promise you to keep bringing you information about where you can get help, about the real science of the disease and its treatment. I want to thank K24 today for having acknowledged me as the woman of the day, for my speaking about mental health. Thank you, K24, for recognizing me and even giving me a platform for people to know what we are doing. I also want to thank those who helped me set up this show. Again, you saw we had technical issues. When you pretend you know technology is when you really don't know. That's what we are learning every day. But please be patient on this show, because I like it to be live so that we have interactions. Please subscribe to our channel, Rachel Shebesh, Mama Nai, Jenga Nai. Speak to people about it, open up our page for us. For us, it's not a matter of too many numbers, it's about how many people we are able to reach, how many people with mental health are able to hear me, how many parents who have children with mental disability, mental health issues, how many people in government who need to do something are hearing us, how many doctors out there are understanding more and more what kind of facilities Kenyans need. This is what this platform is for. Thank you again to my colleague, Nadia, who has a slogan around her Kenyan Mimi program. And I think Nadia and Kenyan Mimi should partner with Yvonne and her Cities Rise group, because that is what she's doing in government, and she has a mental health component on it. Thank you, Nadia, for always telling me it's okay not to be okay. Lastly, I want to just read something that somebody sent me. And this is how I'm going to complete it. At times, being bipolar can be an all-consuming challenge, requiring a lot of stamina and even more courage. So if you're living with this illness and functioning at all, it's something to be proud of, not to be ashamed of. So I'm proud that I'm functioning and I have bipolar disorder. I want you to be just as proud to be able to function even with your challenges on mental health.